What if the doctor who saves your life has no pulse, no white coat, no human face? And what if that doctor is already working in hospitals across the world, reading your test results, flagging your cancer risk, even helping decide what medicine you get? This isn't science fiction. This isn't next decade. This is healthcare AI, and its journey from research paper to real patient care is more real than you think. But the full story, that's something you haven't heard yet. It started with a simple, almost naive question. Can a machine learn to heal? Not assist, not automate. Actually understand illness, diagnose it, treat it, and maybe prevent it. In the early 2000s, this idea lived mostly in labs and lecture halls. Back then, AI meant chatbots, chess engines, and clunky math models. Doctors saw no use for it. They said, medicine is personal. It's based on years of human training, pattern recognition, gut feeling. You can't train a machine to care, but the machine didn't need to care. It just needed to learn. In 2016, Japanese doctors faced a puzzling leukemia case. They fed the patient's data into IBM Watson for oncology. It took 10 minutes for the system to match the rare subtype, a diagnosis that had stumped experts for weeks. That moment became a signal. Healthcare. AI wasn't just possible, it was powerful, not just in rare cases. In radiology, dermatology, cardiology, AI began outperforming average human doctors in image recognition and diagnosis. By 2019, Stanford-trained AIs could detect pneumonia from chest X-rays with superhuman accuracy. In India, AI tools helped screen thousands for diabetic retinopathy in rural clinics, places where no eye doctor was available. The message was clear. The machine wasn't just learning, it was starting to teach us. Here's the part that still confuses many people. What is healthcare AI really doing? It doesn't understand disease the way we do. It doesn't feel empathy. It doesn't know what pain is. Instead, it processes massive amounts of data, millions of test results, images, cases, and finds patterns no human could see. Imagine looking at a million chest scans and noticing subtle invisible cues tied to lung cancer. A doctor might miss it, but AI, it spots the invisible. It learns from every case. It never forgets. And unlike humans, it doesn't get tired, biased, distracted, or emotionally drained. But that's also where things get complicated. In theory, healthcare AI was brilliant. In practice, it hit walls. Hospitals weren't ready. Regulations moved slowly. Doctors didn't trust it, and patients weren't comfortable with it. One oncologist put it plainly, "I've spent 20 years earning the right to make these decisions. Now you're telling me a machine that's never spoken to my patient should make the call?" And there were valid concerns. Could the AI explain why it made a choice? What if it was wrong? What if it was biased? And that leads to a major turning point. When COVID-19 hit, everything got stress tested, especially healthcare. Hospitals were drowning in patients. Time and resources were scarce. And guess what stepped up? Healthcare AI. In China, AI was deployed to analyze CT scans for COVID pneumonia. In Italy, it helped triage ER patients based on real-time risk. In the US, AI tracked ICU capacity, ventilator shortages, and predicted infection trends at scale. It wasn't perfect, but it was fast. And in a system on the edge, fast meant lives saved. Healthcare AI went from someday to right now. Here's the quiet truth. You may have already been diagnosed, guided, or protected by healthcare AI. When your doctor showed you a graph predicting your heart risk, when your smartwatch warned you of an irregular rhythm, when your test results came back pre-analyzed before the doctor saw them, that was AI. It's in radiology labs, urgent care dashboards, electronic health records, fitness trackers. It's in your pocket, it's on your wrist, it's already helping, often without asking. But for all the progress, the biggest questions remain open. What happens when AI makes a mistake? Who's responsible? The doctor? The software company? The algorithm itself? What about bias? If an AI was trained mostly on white male patients, will it misdiagnose women, people of color, children? These aren't bugs in the code. They're reflections of the world we feed into it. And if we don't fix them, we'll automate inequality instead of solving it. The future isn't just about smarter hospitals. Healthcare AI is leaving the building. It's powering virtual care platforms, helping manage chronic illness from home, monitoring patients post-surgery via smart devices. It's also making care accessible in places with no doctors, rural villages, mobile clinics, underserved communities. The goal is no longer just treatment, it's prediction, prevention, personalization. Some fear healthcare AI will replace doctors. But in truth, the future isn't doctor or machine. It's doctor with machine. Imagine a young nurse using AI to detect early signs of sepsis, a rural physician getting diagnostic support from a cloud-based system, a surgeon navigating a high-risk case with real-time AI guidance. The best healthcare AI doesn't remove the human, it amplifies them. We began with one question: can machines heal? Now we face a harder one. Are we ready to let them? Because healthcare AI is no longer an experiment. It's embedded, active, learning, and its influence is only growing. The question is no longer if, it's how we'll use it, who will empower with it, and whether we'll stay in charge of what we built. The journey from theory to hospital was just chapter one. Right now, somewhere, an AI is analyzing a scan, checking a dosage, flagging a risk. Right now, a researcher is improving a model. A doctor is double-checking a prediction. A patient is benefiting from a system they may never even see. The next chapter of healthcare, AI, it's being written today. And maybe, just maybe, you're one of the authors. If you found this topic helpful or thought-provoking, hit like and subscribe so you won't miss the next stories about technology, healthcare, and the future we're shaping together.